It's here. What if a single test could catch pancreatic cancer before it's too late? I'm Dr. James from Pancreatic Cancer Warriors, and today I'm revealing the life-saving exam most people don't know about until it's stage 4, a test that could save your life. And I'm going to show you exactly what it is, why you need to ask for it, and why most doctors miss it until it's too late. You are not going to want to miss this. Okay, quick intro. I'm a medical doctor. I'm also a medical doctor. I'm a medical doctor specializing in digestive diseases, cancers of the pancreas, liver, gallbladder, and all those things. And I am also a patient myself, so I get it from both perspectives. I have been through this journey myself, and my channel has over 100,000 warriors, just like you, who are dealing with this disease, or they love someone who has pancreatic cancer. So, if you're new here, please subscribe so you get this info ASAP. We're in this fight together. I've got your back. Welcome to the tribe. So let's jump right into this. I'm going to answer the 3 questions you probably have right now. First, what is the test? Second, how do I get it? And third, why should I get it? So let's go through them one at a time. First off, there are 2 tests that make up this exam, and you don't need both of them. One of them is a blood test called a CA19-9. Now, this isn't perfect because some people without cancer have an elevated number, but if it goes up, it's a red flag that something might be wrong. The second part of this exam is some kind of imaging test. For me, the best test is an MRI or an endoscopic ultrasound, and let me show you why. Okay, here's a picture of a healthy pancreas. This is what a normal pancreas looks like on MRI. It should look like this, nice and pink. And then you can see this big main pancreatic duct. It should be small and thin, shouldn't be dilated, and then we should not see any masses or any bright spots. Okay, here's another example of a healthy pancreas. Notice it looks very similar to the last one. It's nice and pink. This main pancreatic duct is small and thin, and then we don't see any masses or bright spots. Now let's look at what pancreatic cancer looks like. Here's an example of a cancerous pancreas. This is what it should not look like. And you can see that this tumor is highlighted in yellow. It should not look like this. And here's another example of a cancerous pancreas. Again, you can see that there's this mass, this tumor highlighted in yellow. This is what pancreatic cancer looks like. This is what early detection looks like. You can actually see the tumor here. When you look at these side by side, it's really easy to see the difference. Now the reason I like this exam is because if you find a tumor that's less than 3 centimeters, you're more likely to cure it with surgery. You're not always going to find early stage tumors, but if you find something that's early, you're much more likely to have a chance of curing it. And that's why this exam is so important. Alright, so now that you know what the exam is, the question is, how do I get it? Well, if you have unexplained weight loss plus abdominal pain, you should demand this exam from your doctor. Unexplained weight loss and abdominal pain. Why? Because most pancreatic cancers present with abdominal pain or weight loss. In fact, when we look at studies, about 70% of people with pancreatic cancer have either abdominal pain or weight loss. Now, if you have either of those 2 symptoms, you should demand this exam from your doctor. Why? Well, no. 1. You could have an early stage tumor that can be cured with surgery. And no. 2. Even if you don't have a curable tumor, you may have a tumor that we can put some type of stent in to relieve your pain. And no. 3. Even if you don't have a curable tumor, you may have a tumor that we can put some type of chemo into to shrink it and relieve your pain. So there's multiple reasons why you should get this test. If you have unexplained weight loss plus abdominal pain, you should demand this exam from your doctor. But what if I don't have those symptoms? Well, if you don't have those symptoms, then I would say you should still get a baseline CA19-9 blood test. And here's why. We know that pancreatic tumors double in size every 6 months. And by the time you have symptoms, you have a pretty big tumor, which means you're much less likely to be cured with surgery. You could still have a small tumor that you could be cured with surgery, but it's unlikely. But if you get this baseline test and you know what your number is, now you have something to compare to in the future. Because once your tumor starts growing and it doubles every 6 months, eventually your CA19-9 is going to go up. And then, if it does go up, now you know that you have a problem and you can get the full exam with the imaging and everything. So even if you don't have symptoms, I still think you should get a baseline CA19-9. It doesn't hurt. It's a simple blood test. And so what I recommend to all my patients is I want you to get this baseline test. I want you to know what your number is so that if you ever have symptoms, I have something to compare it to. Alright, so that's the second question. How do I get it? If you have unexplained weight loss plus abdominal pain, you should demand this exam from your doctor. Which brings me to the last question, which is why should I get it? Well, there's multiple reasons why. No. 1. If you have a small tumor, you could be cured with surgery. No. Even if you don't have a curable tumor, you may have a tumor that we can put some type of stent in to relieve your pain. 3. Even if you don't have a curable tumor, you may have a tumor that we can put some type of chemo into to shrink it and relieve your pain. There's multiple reasons why you should get this test. Alright, now that you know what the test is, how to get it, and why you should get it, here's what you need to do. Share this video with someone you love. Share it with a friend. Share it with your family. Share it with your kids. Whatever. And if you're new here, please subscribe because we are in this fight together. We are taking over this disease and we are going to cure this disease together. Alright, now I've got to leave you with one final thought. Early detection is possible. Don't let silence kill you. Ask for this test. Ask for the CA19-9 blood test and the imaging test. Ask for the MRI or endoscopic ultrasound. Don't be afraid to ask for this test. Early detection is possible. Don't let silence kill you. Ask for this test. Alright, thank you so much for watching this video. And remember, you are amazing. Stay strong.